Hi Medical College, Джумагулова Индира Мухановна.
Hi guys, and welcome to How to Gastrit. In today's presentation, we'll be talking about gastritis. So let's get into it.
The aims of the lesson: to organize and present information clearly to others, to understand most specific information, to use appropriate subject-specific vocabulary to talk about a range of general and curricular topics, to ask and respond to questions to get more information. Plan: gastritis and its types, causes of gastritis, symptoms of gastritis, helping with diagnosis, gastritis complication, treatment for gastritis, and treatment medication. Gastritis is an inflammation of the mucous membrane of the stomach. There are acute and chronic gastritis. Acute gastritis requires urgent treatment by a doctor and, in severe cases, hospitalization. After treatment of acute gastritis can become chronic. However, often chronic gastritis is a disease. So, what are the causes of gastritis? Gastritis can be due to Helicobacter pylori or H. pylori infection, patients who are chronic alcoholics, using certain medications like aspirin or other NSAIDs, having certain viruses such as the herpes simplex virus, repeated and prolonged violations of the food, bad chewing, cold and hot food, genetic predisposition, excessive cigarette smoking. The symptoms of gastritis can be aching or sharp burning pain in the upper abdomen, which is exacerbated or disappears in the process of eating, nausea, vomiting, lack of appetite, belching, flatulence, a feeling of fullness in the upper abdomen after eating, weight loss, as well as vomiting blood or coffee ground-like material, so-called hematemesis, and having black tarry stool, so-called melena. Now let's talk about gastritis diagnosis. The patient's symptoms can be helpful in leading us to the pathology. However, we require some diagnostic procedures for confirmation. These are an upper GI endoscopy, blood tests to determine whether the patient has anemia. We could also use the blood sample to screen for H. pylori infection and pernicious anemia, facial occult blood test which checks for the presence of blood in the stool. Gastritis complication. Complications of gastritis may include peptic ulcer, bleeding ulcers, erosive stomach lining, anemia, gastric cancers, mild lymphoma, gastric scarring, and structures with outlet obstruction, dehydration, kidney problems, and death. Only a doctor can diagnose gastritis and appoint competent therapy, independent on the shape and severity. Making some lifestyle changes, such as avoiding alcohol, spicy foods, acidic beverages, smoking, and medications that have a very nasty effect on the stomach. Initial treatments are aimed at using drugs that work to reduce the amount of acid released into the digestive tract, antacids that neutralize stomach acid, such as Maalox, Mylanta, Gelusi, Gaviscon, Rolaids. Your task is to get acquainted with the material, write out new words and complete tasks. Good luck!